For the past 32 years, the world commemorates World AIDS Day on December 1st. And this year's theme is Global Solidarity, Shared Responsibility. And in Trinidad and Tobago, we remain committed to work hand in hand with our global partners, our various stakeholders, and you who have a personal responsibility to do what is necessary to curb stigma and discrimination, and of course, to rock your ribbon to bring awareness to HIV and AIDS. Our main goal is to end this epidemic by the year 2030. And in order for us to achieve our goal, a major component is for us to know our status. The question is, do you know your status? Well, join me today as I visit the George Street Health Center as we do a rapid HIV test. You're going to see how easy and convenient and also discreet it is inside another edition of Wellness Wednesdays with yours truly, Ken Simmons, brought to you by the Northwest Regional Health Authority. So we're here at the George Street Health Center in Port of Spain. I signed my name at the security checkpoint, my hands were sanitized, and my temperature taken. All COVID-19 protocols were observed. I was then told to present my ID card and register my information with the VCT clerk. I found out that VCT stands for Voluntary Counseling Testing. After filling out the form, I was directed to a room with VCT tester, Miss Hedy Kam-Kim. She verified the information on the form and I was asked to sign it in her presence. 2 different rapid tests are used from 2 different manufacturers to ensure accuracy. My ring finger was sanitized and blood taken and placed on the test kits. A running buffer and timer was set for 10 and 15 minutes. During this time, Ms. Kam-Kim shared additional info regarding risk and exposure of the HIV virus. And thankfully, after such time, my result was negative. But I was told that if someone tests positive, a period of time would be given for the emotional state and support. All in all, today's process was easy, confidential, and very much necessary to truly know your status. Watch now, I ain't lying. It feels so good knowing my status, and you could never really know unless you actually get tested. That's why I always say it's so important for young people to be educated about responsible sexual behavior and other related information about HIV and AIDS. I know Rapport is partly responsible for this area. I think I'm going to check them out to find out what they're doing these days.
My name is Sheldon Mason. I work at the Northwest Regional Health Authority Health Policy Research and Planning Unit Rapport as a sexual and reproductive health educator / peer educator. I want persons to be more aware, more cognitive, make correct decisions by becoming more informed. My people perish for the lack of knowledge. Pick up a book, read, use your smartphone for other than WhatsApp and Instagram. Google, World AIDS Day, when was HIV first discovered? These things help us understand and help us become better individuals. So when we decide to make a choice with our sexual selves, we do not go and put ourselves unnecessarily at risk. So we want persons to be more aware. What I want to do is encourage young persons under the age of 18 to abstain from sex until you are old enough to deal with the consequences that comes with sex and you are emotionally intelligent, cognitively aware of how you would like sex to happen for you. What we want them to do is to practice safe sex, use a condom, get tested regularly. If you know you're having unsafe practices and you're having multiple partners, consult your physician. Find out ways that you can keep yourself healthy and strong, because if you are infected and you have multiple partners, then those multiple partners are infected, and therefore those multiple partners go out and infect other partners at the same time.
The Medical Research Foundation is a public facility that exclusively provides treatment and care for HIV positive persons. One of the fundamental issues in relation to HIV is patients' care and treatment. Can you tell us a little bit about that, and what are the primary functions of the Medical Research Foundation?
So the Medical Research Foundation is a non-governmental organization that partners with the Ministry of Health to deliver what we believe is world-beating services to persons with HIV and AIDS. We know with absolute certainty someone living with HIV should expect a near normal lifespan. They should have a healthy, long life, a healthy, full life. There is practically nothing that an HIV diagnosis can prevent you from doing in terms of job-wise, career-wise, family-wise, anything you can think of.
What assurances that you would give someone who may feel a bit embarrassed, feel that their information would be leaked out? What measures you all have in place to ensure that that is simply not the case?
Confidentiality is rule number one, because especially in a small society like ours, we have to be very mindful about making sure that confidential information doesn't leak out. So we have to make sure our staff are trained in that respect.
What are the plans that you all have in place to continue to improve the quality and level of service that you all provide?
We've broken the sort of 8 to 4 Monday to Friday mold so that we have extended hours on 3 days a week. We have a satellite clinic in San Fernando for patients who live in South Trinidad. We even have a Saturday clinic. We have a youth clinic. We have a women's health clinic that has been going tremendously well. We recently started a men's clinic, which I know is of extreme interest to you. We actually deliver services in a way our patients can access those services, and we have to be innovative in how we deliver care to make sure that we don't have any decrease in quality of care as a result of COVID-19 and all the challenges.
So if you fall under any one of the circumstances that may possibly expose you to contract the HIV virus, we want to appeal to your good nature, not just for us, but for you first, and visit any one of the NWRHA's health centers across the country. Make sure to get tested, because ultimately, we want you to know your status. This has been another edition of Wellness Wednesdays with yours truly, Ken Simmons, brought to you by the Northwest Regional Health Authority. Until next time, everybody, take care and God bless.